Hi, I'm Denise. I'm one of the registered nurses at Evolve Aesthetics. One of the most frequently asked questions we get about our weight loss program is how to properly inject the medication, and am I doing it properly? So today I'm going to review with you the entire kit and how to inject, how to draw up your medication, and how to inject it properly. In each kit you will get a vial of Sermorelin, which is the human growth hormone peptide booster. You will get a vial of the semaglutide, which is the weight loss medication. You get a pump dispenser of theophylline cream, which is great for cellulite on your thighs, upper arms, buttocks. You get alcohol prep pads to clean your vial tops and your injection sites, and you get 30 insulin syringes to give your injections. So I'm going to go through step by step. Semaglutide first. You pop the little cap off. Don't try to put it back on. It just says it came from the compounding pharmacy, sealed, safe, and hasn't been tampered with. Clean off the top of your vial with an alcohol wipe. Your semaglutide dosage is going to be based on what we start you at and where we increase you up to. Always turn the vial over. Stick the needle right in the center of the stopper and draw back to what your dose is. The semaglutide is pink, the Sermorelin is clear. Then you gently lay the cap on that so you can lay it down. One of the common questions we get is, how do I know if I'm drawing it up correctly? Or what if I don't turn the vial upside down when I'm drawing it up? If you don't turn the vial upside down, you're not going to get an adequate amount of the medication. You're going to end up drawing air out of the top of the vial. And so when you inject yourself, you've injected yourself with air and maybe half of your dosage, which could make it really dangerous the next time you inject yourself if you turn it upside down and you get a full dose. So we're going to be demonstrating injecting above the knee. So first, we're going to have you grab up a hunk of where you want to inject into the subcutaneous tissue, not the muscle. So you pull the skin up away from the muscle, and then clean that area off with your alcohol wipe. Let that dry really well, otherwise it'll sting a little bit when you go through the skin with a needle. And you're going to go in at a straight in angle, 90-degree angle, just gently pierce the skin, shove it all the way in, and then slowly inject your medication. Regardless of where you do your injection, thighs or stomach area, you always want to pull that skin up, clean it off well, let it dry good before you try to inject. And then rotate sites. So if you inject in your thigh today, do your stomach next week, other thigh the next week, etc. So just to recap, 5 important things. Number 1, the 2 medication vials need to be kept in the refrigerator. The theophylline cream does not need to be refrigerated. Number 2, make sure you're cleansing the top of your vials and your injection site well before you inject yourself. Always use a clean needle for each injection as well. Don't save the needle. Number 3, always turn the vials upside down when you're withdrawing medication. Otherwise, you'll just get air if you keep the vials right side up when you try to pull the medication out. Number 4, make sure you're grabbing your skin and pulling it away from the muscle, regardless of where you're injecting, on your leg or your stomach. Get it up away from the muscle and inject it just in the subcutaneous tissue. And 5, make sure that you're injecting at a 90-degree angle or straight into the subcutaneous tissue. Don't go in at an angle, you want it to go straight in. If you have any further questions that I haven't addressed in this video, please feel free to give us a call at Evolve. We'll answer any questions you have.